As we all know, women not only in South Asia but all over the world suffer from various kinds of gynecological problems in their life, and thousands of women end up having their wombs removed in operations called hysterectomy. Now, astonishingly, I was reading that hysterectomy is the second most frequently performed major surgical procedures of women all over the world, next only to cesareans. And again, in US, approximately 600,000 hysterectomies are performed every year. And in India, we do not have accurate statistics, but I'm sure considering the number of people we have in India, the number would be extremely, extremely high. Now, the big question is that, are all these hysterectomies necessary? And all these are performed when there is need. But I think the answer you may get as a shock is that most of these are unnecessary and are performed apparently by some unscrupulous doctors in countries like India and others to get some extra bucks, or even in developed countries they are performed where because of lack of information about alternate treatments. In fact, many women in India have complained that doctors have frightened them into surgery by saying that the uterus was cancerous. Uterus kharab ho gaya. That is the kind of thing which the rural women are told by doctors. And then in their anxiety, many of them succumb to the thing where they are given no other option. However, in many cases, even in developed countries, apparently the diagnosis is made only on the basis of things like ultrasound without going through other foolproof methods of conclusion. So that's how these things are handled. And in many Indian villages, as many as 90% of the village women, including many in their 20s and 30s, fall prey to such kind of diagnosis. And in contrast, also, there are countries like UK, where I was reading that there is hardly any women in the 20s and 30s who are subjected to hysterectomy, but only when they are 40 and 50. But even then, this thing is done only as a life-threatening, if it is a life-threatening thing, and otherwise they try to find an alternate method. The other day, I was having a chat with Dr. Romi Chopra, and he explained to me that almost 80% of the childbearing women tend to develop some kind of uterine fibroids, and more than 75% of the hysterectomies, according to him, are unnecessary. This was something which was an alarming news to me, and that was the reason which we discussed. Then if this is the case, why not we take this message to as many women as possible, starting from Chicago, starting from the consulate itself, and take this message forward. As we know, every year there are advancements in medical science, and medical science has provided alternative treatments, and all these are to be explored before women are subjected to hysterectomy. So this is the main reason behind organizing this seminar today, so that you get precisely this kind of educational information. Consulate is very happy to support the initiative taken by Dr. Romi Chopra and his team, and we will be more than happy to be of a constant medium to you to promote this message across through this kickoff ceremony. I welcome you once again, and I pass on the floor to Kathy to introduce Dr. Chopra and then take the floor forward.
So honored to be here. Dr. Chopra is probably the most passionate physician that I work with, and I mean that, and I work with a lot of doctors. He is such a passion for women because his main goal here is to educate all of you on options. Sadly, there are so many women, like he had mentioned, that have hysterectomies because of fibroids, and the thing I really respect about Dr. Chopra is that he looks at it differently. He takes the whole mind, body, and soul. There's no other doctor that I work with that does that. And just being in his presence, he has such a healing, calm sense to him. So if you can walk away today, male or female, obviously you guys don't have uterine fibroids, but I know that there's someone that you know that does, whether it's a mom, a sister, a neighbor. Our biggest goal today is to make sure you walk away feeling educated and empowered to know that you have options. So you don't have to only have a hysterectomy, but you can walk away knowing, that you can do something else besides surgery. So I am honored to welcome Dr. Chopra, world-renowned Dr. Chopra, and he's going to hear and educate you. Thank you.
I thank the Consulate General First Lady, to be with Kathy, everybody else for having me here. I have the gift of gab, so I can talk for hours, but I'm not going to do that to you. And everybody here speaks Hindi?
Yes.
Yeah, okay, perfect. So, you know, सरदार जी को पूछा था कि भाई सरदार जी आप तो सब जगह शेर बने फिरते हो, घर में क्या होता है? मैंने कहा जी दुर्गा माता चढ़ के बैठ जाती है. So you're right. The best man for the job is a woman. I'm going to consider a sex change, but that would be tough for me, I'm sure. So. All right, so I'm going to talk to you really about women's health. And one of the key things that I have found is that the lack of education, even in the most educated of countries, like the US, leads to some real drastic options. So there are quite a few men in the room. So let me ask a simple question. How many of you, for a benign lesion, would agree to get castrated? No cancer, you'll be castrated. Anybody put their hands up? No. I'm going to ask you, for $1 million, I want you to give me your left thumb. Anybody give me your left thumb? Now one hand went up. It's interesting that over 800,000 women in the US alone, and many similar number in India, are subjected to a hysterectomy. And I'll show you some pictures, maybe a little gory but mild, and you'll see how the lack of education, especially in this area, has caused a problem. So Mother's Day is coming around the corner, and so happy Mother's Day to everybody. And there's a reason why the Earth is called Mother Earth. Because, you see, everything comes from the sun. Without the sun, no sunlight, no life. That's why we say somebody's enlightened. And the Earth obviously came out of the sun, it's been rotating, revolving. No human has left this planet alive, ever. More than 120 years, no human has ever lived. There's only mythology. And Mother Earth, that's why Mother Earth has a very important role. No uterus, can't have a child, no Mother Earth. So, and it's interesting how women are put through that. So that's one of the things that comes into play. Obviously, in a society, if you have a mother who is not educated, the whole family has a problem. You educate a man and you educate an individual. You educate a woman, you educate a family. And ultimately, you could be an emperor. You could have all the resources in the world, but you need to feel loved. It's a human need. So when patients come to me, the first thing is, and love is not about sex. Love is about caring. Love is about you emotionally being told you are okay. That's what you do to your child. That's how we kind of go through our lives. If you are wealthy, you are healthy, everything is good, you're loved, what do people do after that? Then it's intellectual survival, mental. They take glasses of wine, they sniff it, they travel. Oh, this is from Argentina, this is from here, this is from there. We have now a need for mental and intellectual survival. When all this is done, so a lot of women come to me saying they don't look good, can you clean it, but there's a problem underlying it. The example I give my patients is you live in a house, you have a basement. And imagine that you have 3 basement levels down. Water went down, that's from the heart, went down to the basement. How does it come back up? You have a sump pump. The sump pump fails, water settles down. And if you look at the wall, it is stained. आगे पेंट कर दिया थोड़े दिन बाद फिर stain आ गया. Why? Because it's leaking behind. So you have to fix the leak behind it and then paint the wall. It's the same with these paints. Thank you. Any questions?
And yes, happy life, happy wife. So yeah, take care of your wife, take care of your daughters, take care of your mothers. It's important. So yeah, please enjoy the refreshments. There are a couple of announcements of the future coming up events that we are going to hold. The very close one is Glory of
SONQ. And first name is Sriram. So S something beta messenger. So how do I get the information about you? Sanskrit and all that, we like them.
Whenever it happens, and then I'm done. It's like, are there any questions? Everybody sits there looking at you like, I'd love to get out. So when are we starting?
She's right now in India.